My name is Sunny and I'm a nurse practitioner. I'm going to be doing a physical exam today. I'm just going to start by sanitizing my hands. And I'm going to start with a general survey. I'm noting the patient is sitting upright in no acute distress. Rests are easy and regular, and you're maintaining good eye contact. Next, I'm going to assess orientation. Can you tell me your full name?
My name is Miriam Sally.
And can you tell me the date?
Today is February 21st, 2020.
And what city are we in?
Vancouver.
Excellent. Next, I'm going to assess speech, language, and comprehension. I'm going to get you to name a few items. Can you tell me what this is?
Cup.
And can you tell me what this is?
Keys.
And this?
A pen.
Excellent. Next, I'm going to have you repeat after me. No ifs, ands, or buts.
No ifs, ands, or buts.
Excellent. And now I'm going to have you follow a set of instructions. Can you put your left thumb in your right ear and then point to the ceiling? Very good. So speech and language and comprehension is intact. Next, I'm going to inspect and palpate the scalp. And I'm just assessing for any abnormalities or any areas of tenderness, and I'm not noting any. Next, I'm going to move on to the cranial nerve exam, starting with cranial nerve 1. So I will be assessing your sense of smell, and I'm going to introduce some familiar scents. So we'll do this by having you occlude one nostril and close your eyes. Can you tell me what this scent is?
Coffee.
And we'll do the same thing on the other side. I'll get you to occlude the other nostril. And can you tell me what that scent is?
Cinnamon.
Excellent. So olfactory nerve is intact. Next, we're going to move on to cranial nerve 2 and assess visual acuity using a Snellen chart. So this would be done by having you cover one eye and read from the top line of the Snellen chart, moving your way down, and we would repeat this on the other eye. For the purpose of this exam, we will assume visual acuity is 20 out of 20 in each eye. Next, we're going to assess visual fields. We're going to do this by having you cover your right eye. And I'm just going to have you look at my nose and tell me how many fingers you can see.
1, 2, 2, 1.
Good, and we'll repeat the same thing on the other side. So you'll cover your left eye and looking straight at my nose. Can you tell me how many fingers?
1, 2, 1, 2.
Very good, so visual fields are full. So next we're going to assess red reflex. So I'll just have you look straight ahead, and red reflex and fundoscopic exams should be done with the lights off. So I'll have you look straight ahead. And I'm noting an orange reddish reflection off the pupil, which tells me that the red reflex is intact bilaterally. Now we'll move on to the fundoscopic exam. So I'll be assessing the optic disc, starting with the right eye. And I see that the optic disc borders are well defined and clear, and the color of the optic disc is orange to pinkish and well perfused, and cup to disc ratio is 0.3, which is a normal finding, and I'm not noting any papilledema. Next, we're going to move on to cranial nerve 2 and 3, optic and ocular motor. And we're going to start with assessing the pupils, and I'm noting that the pupils are size 3 and they're round and regularly shaped. Next, I'm going to assess the reactivity to light. And I'm noting that both pupils are reactive to light, and direct and consensual pupillary light reflex is intact. Now we'll assess accommodation. I'm going to have you look at my finger and look at an object in the distance, and look at my finger and look at an object in the distance. And I'm noting that pupils dilate when focused on an object in the distance, and that pupils constrict when focused on a near object, which is a normal finding. Next, we're going to assess convergence. I'll just have you look at my finger and follow it as I move towards the bridge of your nose. And I'm noting simultaneous movement of the eyes inwards, which is a normal finding. Next, we're going to assess cranial nerve 3, 4, and 6, ocular motor, trochlear, and abducens. And we're going to assess the 6 cardinal directions of gaze. And I'm going to do this by having you look at my finger And keeping your head fixed, I'll have you follow my finger as I make a wide H pattern in the air. And I'm assessing for any nystagmus or deviation, and I'm not noting any of that. So extraocular movements are intact. Next, we're going to assess cranial nerve 5, the trigeminal nerve, and I'm going to start by assessing sensation of the 3 branches of the trigeminal nerve, and I'm going to introduce soft touch and pinprick, and I just want you to identify what you're feeling, if it's soft versus sharp. So have you close your eyes? Can you tell me what you feel?
Soft, sharp, sharp, soft, soft, sharp.
Next, we'll assess motor function of the trigeminal nerve, and we're going to do this by palpating the temporal muscles, and I'll have you clench your teeth and move your jaw side to side. And we'll repeat the same by palpating masseter muscles, clench your teeth, and move the jaw side to side. Very good. Next, we're going to assess cranial nerve 7, the facial nerve, and we're going to assess facial symmetry I'm going to ask you to raise your eyebrows and close your eyes tight, and don't let me open them. And open your eyes and puff out your cheeks, and don't let me deflate. Good, and smile as big as you can and show me your teeth. Excellent, and I'm noticing that facial symmetry is intact. Next, I'm going to assess cranial nerve 8 using the whisper test. I'm going to whisper a word or number in your ear, and I'll have you repeat it back to me, okay? ABC.
ABC. 1, 2, 3.
Excellent. And now I'll assess cranial nerve 9 and 10, glossopharyngeal and vagus. I will start by assessing the palate and uvula. Can you say ah? I see that there is symmetrical rise of the palate and the uvula is midline and no deviation is noted. Gag reflex would also be tested, but for the purpose of this demonstration, I won't test this at this time. However, in order to assess gag reflex, you would be using a tongue depressor. Next, we'll do cranial nerve 11, spinal accessory, and I'm going to start by assessing trapezius strength. And I'm going to have you raise your shoulders and shrug into my hands against resistance. And I'm noting for any weakness, and I'm noticing that strength is equal bilaterally. Next, we're going to assess cranial nerve 12, which is hypoglossal, and I'm going to be assessing tongue symmetry, strength, and position. So I'll have you stick out your tongue and move it to the right and the left. Very good. And I'm noting that tongue is midline and symmetrical movements are intact. Now I'll have you push your tongue to the inside of your right cheek, noting the strength, and we'll repeat on the other side. And again, noting strength, and I'm noting that strength is equal bilaterally. And that concludes the cranial nerve exam.